Welcome to the North State Breakdown with Benjamin Nguyen. Today, I'd like to discuss why the fight for fair wages for IHSS workers in Siskiyou County matters to public safety and community stability. IHSS stands for In-Home Supportive Services. It's the program that allows older adults and people with disabilities to receive care in their own homes, rather than being pushed into far more expensive institutional settings. In Siskiyou County, IHSS currently supports more than 560 seniors and people with disabilities, with care provided by nearly 490 home care workers. That care includes everyday but essential tasks, things like meal preparation, mobility assistance, personal care, and some paramedical support, the kind of work that makes independent living possible. From the county's own budget documents, Human Services alone represents over $33 million in annual financing activity, making it one of the largest service areas the county operates outside of law enforcement. So IHSS isn't just a niche program. It's part of a much larger health and human services system the county already depends on, and one that only works if it's staffed. Now let's talk about what's happening on the ground in Siskiyou County. First, the need for care is growing. In the most recent fiscal year, Siskiyou County's IHSS caseload increased from about 524 cases to about 563 cases. That's an increase of 39 people, or roughly 7.4% in a single year. More seniors and people with disabilities are qualifying for in-home care, and they're qualifying at the same pace as the rest of the state. At the same time, the number of available caregivers is going in the opposite direction. As of November of 2023, Siskiyou County had about 510 IHSS providers. By November of 2024, that number had dropped to about 486 providers, a decline of 24 workers, or nearly 5%. So in plain terms, more people need care while fewer people are able to provide it. That imbalance shows up clearly in something called authorized versus paid hours. When someone qualifies for IHSS, a county social worker conducts an in-home assessment and assigns a specific number of hours per month that person is approved to receive. Those are called authorized hours. They represent the level of the care the state has determined is necessary for someone to live safely and independently. In 2024, Siskiyou County authorized over 622,000 hours of care, but only 573,000 hours were actually worked and paid. That leaves nearly 50,000 hours of approved care that went unfilled, about 8% of all authorized hours. For comparison, the statewide average rate of unfilled hours is closer to 4%. Those unfilled hours matter. They mean real people didn't receive full care that they qualified for. And they also mean that state and federal dollars set aside for that care never made it into the local economy. So why is this happening? One factor is the basic math of wages and living costs. The wage used in Siskiyou County's IHSS cost analysis is $16.50 an hour. But according to wage studies, a single adult in Siskiyou County needs about $22.03 an hour just to cover basic expenses. When the job doesn't reliably cover the cost of living, people leave, not because the work isn't important, but because it isn't sustainable. And that's the core tension behind the IHSS issue. A growing need for care, a shrinking workforce, and a widening gap between what's approved and what can actually be delivered. Once you see the gap between need and workforce, the next question is obvious. What happens when IHSS can't meet demand? From the county and state perspective, IHSS exists for a reason. It's widely understood to be the most cost-effective way to provide long-term care for seniors and people with disabilities. Many people who receive IHSS qualify at a level that would otherwise place them in a nursing home or other institutional setting. Those alternatives are dramatically more expensive. Long-term institutional costs can cost tens of thousands of dollars per year, and in higher acuity cases, well over $100,000 annually. By comparison, average IHSS costs per recipient are far lower because care is delivered in the home on an as-needed basis rather than around the clock. State analysis has found that when IHSS keeps someone in their home instead of entering institutional care, it can save roughly between $22,000 to $153,000 per person per year, depending on the level of care that they would otherwise be required. That's why IHSS plays such a central role in California's broader healthcare strategy. Programs like Medi-Cal increasingly prioritize prevention, stability, and community-based care because institutional care is both more expensive and, in many cases, worse for quality of life. But those savings only exist if the system works. When IHSS can't staff authorized hours, people go without care. Healthcare conditions worsen. Families are forced to fill gaps, often unsustainably, and more costly emergency or institutional care becomes more likely. In rural counties like Siskiyou, where distance is long and alternatives are limited, these effects are amplified. IHSS is one of the quiet systems that helps prevent crisis before they spill into more expensive and more visible parts of the government. When it works, most people never notice it. When it doesn't, the consequences show up everywhere else. So taken together, the picture is clear. The number of people qualifying for in-home care is rising. The number of available caregivers is shrinking. Tens of thousands of approved care hours are going unfilled. And the most cost-effective care option becomes harder to sustain. IHSS sits at the intersection of public health, economic stability, and community safety. Understanding how it works and what happens when it can't fully function helps explain why this issue matters far beyond the people directly involved. And that's the breakdown.